Hi, everybody. It's Dr. Laura Hanson, and welcome to my podcast, Connect My Brain. So glad that you're tuning in with me today. Today, we're going to talk about depression and neurofeedback. We've been in a series kind of looking at some of the very popular reasons why people might be experiencing something and have tried neurofeedback and really focused on the results that people are getting. We've looked at attention, we've looked at anxiety, we've looked at insomnia. You can go back and listen to all those podcasts. But today we're going to focus on depression. And I always want to say a few words about my credentialing and what I am trying to bring to you with the professional standing that I have. I am a chiropractor. I have my master's in nutrition. I am a pediatric diplomate. I am board certified in neurofeedback. I am a neurodevelopmental therapist, and I am a certified autism specialist. I'm also currently working on my diplomate in QEEG, which means it is reading the raw data that you are looking at when somebody has a brain map. I will still always utilize the neurologists that are part of our team in getting reports and looking at what is actually happening in somebody's brain, because I really believe in a collaborative effort when we are managing people. I think it's just more than one person, more sets of eyes on something. It'll really help you look at the individual from every possible avenue. I am not a counselor. I am not a psychiatrist or a psychologist. I am not bringing information about these different diagnoses such as anxiety, depression, even attention deficit. I'm not coming into our discussion from that background. But I think today, more than ever, we are so fortunate to have so many different tools at our fingertips as a community that complement one another and really put the patient in the center of the equation, and what type of service could really benefit that person. Even in discussing different diagnoses in neurofeedback, I've said so many times, neurofeedback was never intended to be a standalone therapy. It's meant to work in conjunction with the whole person. My primary patient load is children. I would say my practice is 95% kids. And so when I decided to move in this direction, it was very organic, but I put together a 3-tier approach, mechanical, chemical, brain, because you are all of those things. In the next podcast, which will be the last podcast for this series, I'm really going to tie a lot together with that kind of background that I have, where we really look at the whole history of the person. You know, as I learn about these different situations like depression, there's so many pieces to this that are still so unknown. And then there's still some information that leads us back to that developmental period. And lots of times when I'm describing to a parent or to an adult, because we do see adults and I still utilize the same direction. But a lot of times what we're talking about is, you know, the brain is wired over time. And it's never the same for every individual, because the individual has to have an experience And all of our experiences are different. And one person that I really love her work, Dr. Caroline Leaf, she's even talking about these 7 pathways that are literally the network of coming together to shape individuals. And she's actually come up with a way for you to figure out what is the order in which you use these 7 pathways. We all have the same 7 pathways, but how do you use them? For example, you might say about yourself that I'm a more artistic person. I'm a more linear person. So it's these little differences that we have that have all come together based on the experience that we've had. And that is what has led us to being the adult brain that we are today. But there can be things, especially in the world of anxiety and depression, things that are really plaguing our world right now. Not only do we have what we may have been wired up with, but we've had a very difficult few years. And when you really look at the history of depression, one of the things that just really breaks my heart is they've correlated so much of depression to an increased rate of suicide, and especially that this has really increased in our young people. And so to me, I want to be part of a solution. I want to be about what can we do, and it's okay if we bridge our resources together. So I don't want to step on anybody's toes when I'm doing my podcast. I want you to always keep this background information about me at the forefront in the way that I might explain something or suggestions that I may offer. I don't want to make anything sound like that it's just a very simple fix. We can just do neurofeedback and you're going to be perfectly fine. Because while I've been doing neurofeedback since 2008, I've definitely seen lots of people get completely resolved, but I've seen people too that didn't progress as much as I would like them to. And yes, I do think there's also a part of, how much effort goes into it, but some people might be in a position that effort is just unfortunately not available at a particular time. So no matter what you're going through right now, please feel compassion from me. Don't take anything like I'm trying to say you haven't done enough, or that I'm oversimplifying how you're feeling, because that's not who I am. But I do know that if we incorporate the brain in any kind of chronic pattern, I know we make a shift. I've seen it over and over and over again. After we do brain maps here at the office, and if somebody decides to accept the recommendations and come on board and do a program, one of the very first things that we do is a stress response test. I've certainly talked about stress many times in many podcasts, but it is that fundamental that it is so important for us to constantly go back to that, because when things go on, it is the physiological event in which a human being tries to deal with something. And one of the things that, regardless if you're reading research papers from neurologists, or you're reading papers from a neurofeedback tech, or you're listening to a TED Talk, everybody is very clear that we can associate different conditions to set patterns that can either be identified in brain mapping, or there is a consistent reported pattern that literally is always leading into a particular direction or category, such as anxiety, such as depression. And this is true. I see it myself in practice, and stress is the same way. If you have been going through many things and you are still looking, you are still hopeful, which I really hope that you stay that way, you understanding how that stress response really plays a huge part in not only the pattern, but the chemistry of the body, because there is a physiological event that occurs every single time you are in stress. Now, let's also remind everybody, stress is not only an emotional response, it can be a mechanical response. If the body is constantly fighting itself, and I see this in children when I look at their development, where the body is instrumental in wiring up the brain, and if there was anything that was interfered with mechanically, emotionally, chemically, then development is going to be changed. And now that becomes that little person's experience. And these things would be like low motor tone, or they didn't crawl, or they crawled really late, or they walked really late. You might think of that only as a mechanical issue, but it's part of the wiring of the brain. So when you think about development, always keep in mind that you could not read, write, and do arithmetic when you got here. But the very thing that you did all the time is move. They're even asking the pregnant mom when she goes in for her appointment to be checked out during her pregnancy, whether it's by a midwife, an OB, whatever plan you have or had, they're asking you, do you feel the baby moving? Movement is everything. And I'm even going to tie that back if we look at what is one thing we could do while we're still trying to maybe figure out what's the next step in trying to deal with depression. Move. And I don't care if it's a 5-minute walk. It's a place to start. And maybe you would only do 5 minutes the first day, but maybe the next day, maybe you do 5 minutes, 30 seconds. You have to put in this, I don't want to say the same amount of steps, but you have to put in a lot of steps going in another direction in order to give the feedback to the brain and the body to begin to shift. So mechanical can absolutely be a stressor. For a child, if they're in such a delay with their mechanical pieces, they have to fight this body so hard in order just to sit in a desk or a chair. And that is going to really take away from their ability to pay attention. For the adult, maybe you'd really like to lose some weight. If you don't have the drive and the motivation and your weight is going up, the body, the feedback coming from the body is going to be sluggish. Chemical can be all kinds of different imbalances. And this is one of these things that you cannot simply perceive everything that's going on inside. And I'm going to go a step further. You've got to find some good functional testing so that you can really look at the biochemistry of the human body. Unfortunately, traditional labs are being changed all the time. They are taking the averages of who takes the test every year, and the within normal limits are being changed. You are not a changing within normal limits. You are biochemistry. The other thing is, we are all a little different. There cannot be just one simple standard for everybody, and that's going to be the gold standard. Your background will definitely suggest some possible differences. When you do functional labs, those kinds of things are being taken into consideration. And then there's absolutely the emotion. I really have to say, in all the years of doing this, any person that has come into my office dealing with depression has always had some type of an event that they can pinpoint, or a roundabout if they're helped along the line, that they can understand where something began and how they started feeling this way, or how that could have contributed to how they're feeling this way. So globally, when we talk about depression, it's a dampening effect from the body. There's typically 3 areas that I'm going to give an example and try to explain where the feelings could be coming from and why you must consider your brain in the process of the journey to go in the other direction. So one of the things about our brain is that we've kind of been brought up to think that one area does this, one area does that. The communication today is more about the networks that are involved in the communication. It isn't just one area. It might be one area communicating with many different other areas. And so what we find, especially when we do brain mapping, we're able to see if that area is well organized and if it's stable. And the way that we're looking at this is the timing and the power of those networks. In research, most of the papers talk about 4 different networks that are involved, and maybe their dysregulation is leading to the feeling of depression. So one network is called the affective network. And this is how you take in your world, and basically how do you let it affect you? Do you look at everything with rose-colored glasses, or do you look at everything with just clear glasses and stress? Okay. Reward network would be another one. The reward network is truly the basis of neurofeedback, but it's also why neurofeedback uses the reward network, because we use it. If I am getting positive feedback from doing my podcast, and people are subscribing and people are calling, and there's a community, back and forth of information, I'm getting rewarded in my mind. There are positive reinforcements for what I'm doing. There's also the default mode network. This one is when you are not involved in a cognitive task. This network comes up, and it's what would allow you to kind of zone out and kind of daydream. The 4th network that is believed to be involved is the cognitive control network. So 4 different networks involved that if something is dysregulated and unorganized, may lead to the feeling of depression or negative moods or a mood issue, which is why I can say, if that is the case, and we can literally quantify that on a brain map, then we've got a foundation to start from. Now, let's talk about timing so we understand what that means. So is it overpowered, or is it running too fast, or is it running too slow? And therefore, it's going to impact how it's going to communicate throughout the rest of those networks. And in fact, what they have found is that the effective network and your default mode network are running too much. And so there's way too much connection going on. Now, if I have too much going on in my effective network, I really can't look at a situation easily and, push any negative aside. I'm actually going to ruminate or play over and over and over again a negative result. Now, again, I want to emphasize something. If the connection is too much and I'm doing too much of it, and I don't know how to put the brakes on, and I don't even know that I need to put the brakes on, you're going to be practicing that pattern. And that is something that is commonly talked about. It really doesn't matter if it's neurologists talking about it or it's somebody like me talking about it. We are creating a pattern. And the pattern, the more it is enhanced, is obviously going to take over. Now, if it is the default mode network, then I am going to shift my focus from the external, bring myself out of that daydreamy state, get into the external. I'm going to stay in the internal, and I'm going to be more focused on my internal thoughts than on the external thoughts. I'm going to constantly play over the negative thought. How do you think happened? What do you think the causes were? And it's going to go into a rumination or just running. It doesn't know how to stop. And again, you may not know that that's what's going on. Now, the other two, that would be the reward network and the cognitive control network, are under functioning. They are attenuated. They are not coming on. They're hypoconnectivity. So if it is the reward network, this is where you lose interest, motivation, and you can't really find pleasure. And then if it is the cognitive, well, I think that something we can put together pretty easily is that if we're emotionally dampened, it's very difficult for us to rely on executive function to try to reason ourselves out of it. So it's kind of like a top-down pathway. And if the cognitive is down, the rest of it is having a really hard time finding its way out of the equation. So there are known networks that are possibly playing a huge part in why somebody could be depressed. And in the medical neurological circles, they literally have gone in and made little holes in the brain and stimulated different parts of the brain. One area that they go to a lot is known as the Brodmann area 25, and part of these networks, and stimulate it. And in real time, people have had a shift and have felt differently. For me, I would rather try something a little bit less invasive and see if I could get that type of a response. And when I was looking at this, I said, this is neurofeedback. We're just not drilling holes in the head. We are stimulating these particular areas because we've got a map. We can quantify where these asymmetries are, where the connectivity is either too fast or too slow, and we can begin to target through electrodes or leads, and patients can get that very same response in real time that a shift is happening. And you go back about every 10 sessions and you literally are able to chart your progress. And so, of course, it's an individual's choice which way that they want to go. But I think neurofeedback is showing some very strong promise in this area, even on cases that maybe nothing else has been working. Now, another benefit of neurofeedback, I certainly have patients right now who are on medications, and that's often a question. When you're doing neurofeedback, which is the therapy, and this is also considered biofeedback EEG. So you are literally working with your brain waves. We are enhancing the reward network. You are receiving the reward in real time in the mode of a visual awareness and an auditory awareness. And you are able to know that you are getting in that place. So the reward network is a big part of neurofeedback training. It's the foundation of how somebody is involved in the actual training. Okay, so that's the first part. The first part is we do a brain map, or maybe you already have had something like this done and at least it can give you some validation. But we would do a brain map and we would be able to see what's going on with the power, the organization, and the connectivity of the brain so that we could help begin to understand that what you're going through is being validated right on the map. And I think when you see it, it's very comforting that you are being heard and that you know that there is a possibility that this type of training could be very beneficial for you. Now, a second thing that I want to look at for understanding depression is if we have too much of a slow wave, and this is primarily delta and theta. Delta is your sleep wave and theta is your precursor to sleep. It's also like for daydreaming, and it's also your subconscious. And if there's too much of that, then it's very difficult for you to feel that up. And I think this is one of the classic findings on a brain map that can really help somebody understand how this top down, this brain, not just executive function down to the brainstem, but how the brain is giving feedback to the body. So often we do things around the brain and we don't include the brain. And the only way that you're going to know, in fact, if this is going on, is you have to have a brain map. So if we have too much of the slow waves, it can literally cause a dampening, depressed feedback mechanism to you. The third area is that there is a normal, innate, organic asymmetry to our brain. Now, lots of times I find asymmetries in many different areas of the brain, and that part would be very difficult for the brain to handle. But in this situation, it has to do with your frontal lobe, and it has to do with on the left side of the brain, we typically have higher beta power. And beta power is directly related to executive function. So beta, faster brain waves, it matches being able to get that action, implementation, and drive. Where on the right side, we typically have more alpha for focus and calm. But both of these are within range. It's not too high and it's not too low. So an example would be is that maybe there's something I want to work on and I need to be a little creative and think about how can I tie back this idea that I have. And that's where timing again, I'm going to be calling on my left side of my brain. Take this idea and help me get it going. And so if that asymmetry is imbalanced, it too can be another cause of depression. So there's many reasons why people can be struggling, for sure. And we're breaking it into categories of absolutely there are emotional things. And there are lots of different approaches that you can work on these emotional issues that you want to try to either find clarity or you want to get some examples of strategies that you could be working on. And you could also tie in neurofeedback. Again, not only do we have people here that are on medication, but there are also lots of people call and are being recommended to do neurofeedback by the person that they're doing some type of counseling with. There is a great bridge between these types of therapies. Also, if you're on medication, neurofeedback really makes that medication work better, and you and your provider can be discussing that. So this isn't about trying to take you away from anything that you're doing, but perhaps if you added the brain into this equation, you would get faster results. And that to me is what we're all looking for when we've got something going on. How can we get it resolved? How can we move through this as quickly as possible? It can be a chemical imbalance. You could be working with somebody. You may not even know that that's a possibility. And getting some functional labs can really make a big difference in looking at that equation. There are so many things that are known about maybe a genetic snippet or perhaps a neurotransmitter imbalance. And when I get into the series of nutrition and things like that, we will highlight all of those areas. But even when patients come in now, that's why I do a 3-tier approach, mechanical, chemical, brain. You really want to treat that person as the human body works. And then, of course, as we were discussing, there could be mechanical reasons that are giving this feedback to the brain that could either cause an asymmetry or perhaps some type of disorganization because of the way the brain is getting wired up. And on my last podcast for this series, I'm really going to highlight that. Now, I had mentioned that one of the things that we do here, if you do decide to move forward with care, is on day 1, we want to get that stress response. No matter what the direction that is causing the dysregulation in the brain, mechanical, chemical, brain, and certainly combinations, the physiological response is going to be a stress response. So if that keeps going, it is literally going to put that person in a chronic state of stress. And when we get to that state, the brain is hearing 2 messages, fight or run. And so in combination with doing neurofeedback or biofeedback EEG, we're going to also work on the vitals, because that's what we're testing when we do a stress response test, because that's what's involved in that physiological reaction. So not only are we going to look at the brain in its response to forced stressors, but we're going to look at heart rate. Above the age of 15, our system allows us to also look at heart rate variability. Children absolutely have heart rate variability, but with our software, we are measuring typically people above the age of 15, which we would go over this because developmentally, heart rate variability is coming in via the Moro reflex. So absolutely, children have a heart rate variability, which means that there is a balance, a cooperation, an orchestra between the cardiovascular system and the respiratory system. And when you take a breath in, your heart rate goes up, and when you exhale, your heart rate goes down, and that exhale should always be longer than the inhale. And so what we're looking at is the heart rate doing that. So regardless of your age, you will do heart rate variability training, because this is one of the core ways to balance out the autonomic nervous system, which is the sympathetic, aka fight or flight, and the parasympathetic, aka rest, feed, and breed. And we need a balance in that system so that we can begin to break the pattern, so that we can begin to make that human being, that physiology, that connection, that network, that communication more flexible, so it can begin to go in another direction. So all of these are pieces that work together in order to begin to change that state of mind. And that's what we truly believe in here at Connect My Brain. You didn't get this way in one day. You won't change in one day, but you can get hopeful immediately, and you can begin to go in another direction. Neurofeedback is best done with a minimum of 2 sessions per week. We recommend, if you can, have a little jump start, maybe come in 3 or 4. And I'm always going to work with you and coach you on strategies. What are you going to do the days that you don't come in? If you're someone that maybe you're outside of the Atlanta area, we do have remote neurofeedback. It is my personal belief that it is to your best advantage if we could do your map here at the office, work with you for a week or 2 so that we could teach you. Oftentimes I find that when people rent the equipment, they don't really take it home and put it to action. Because there's a learning curve. And if you've got to do everything without practice and smoothness, sometimes you become reluctant. Sometimes you withdraw away and you don't get the work done. But maybe you want to learn a little bit more about my approach. So over on the website, under the eSchool, I have a Connect journal. This is a 30-day journal to help you learn some techniques. You have to practice every day. Remember, if I want to get off that hamster wheel, and I've always been turning right, I got to turn left. I got to step off the wheel, and I got to go in another direction. The journal is set up to help you go one day at a time, 30 days in a row. You begin with a breathing technique. Then there's a little training about your brain. And then I want you on day 1 to pick one obstacle that you want to work on. That obstacle is going to go with you all 30 days. And you're going to constantly be asking the same questions based on the information that you learned about your brain that day so that you can continuously fine tune your thoughts. There's strategies in there to help you stop the ruminating thoughts. I'll share it with you right now. Literally speaking out loud, holding your hand up and tell yourself to stop. This would be a visual cue and an auditory cue, just like we're doing in neurofeedback. If you try to do things with your own internal thoughts, well, you're going to be using the internal thoughts and power ranges that we probably would have found on your map. And it's always going to be a perspective that you want to change. So you say it out loud. If you're living with someone, if you have your family there, let them know, I'm going to be shouting stop. So don't think I'm going crazy. Know that I'm ready to take a step in another direction. I'm going to turn left instead of always going right. Now, here's the deal. Maybe day one, maybe you're going to yell it out loud 200 times. But maybe day two, maybe it's only 195. Give yourself a little grace. Stay hopeful and realize that you can change this brain. You have neuroplasticity on your side. I know sometimes it seems like you may have tried everything, but if you have not tried neurofeedback, you have not tried everything. Well, I hope this gave you a little bit of insight. This is a fabulous system up here. There's all kinds of networks, and they talk to each other all the time. Remember to get out there and get some movement. I think we may be getting an early fall. It's okay by me. But get out there, get the sun in your face. Try to get some sunshine in your eyes in the morning and at a sunset. It really helps set the rhythm of your circadian rhythm, which is going to help your sleep. Take a step. Go look at that journal. And always know, if you want to have a chat, you can call. The office number is 678-501-5172. You can private message me on Facebook over at Connect My Brain. You can send me an email right through the website, connectmybrain.com. Make sure you subscribe. Check out that we've got all of these podcasts on YouTube as well. And we hope to hear from you. And no matter what, I want you to know that you can change your brain. Have a wonderful day.